interesting. So centanafadine, we've been trying for years to develop a triple reuptake inhibitor, and it's been very hard to get the ratio of blockade of those three transporters just right. Well, finally it looks like it's been done. So centanafadine, think of it as an NDSRI. It has highest affinity for norepinephrine transporter. Next is dopamine, and then serotonin. And that actually was done on purpose. This was selected from a portfolio of triple reuptake inhibitors. Really smart guy named Frank Bymaster said, this is the one that has the optimal ratio. But what you're showing here on the left is the baseline PET scan and then post-centanafadine as far as blocking these transporters. And so basically you see what's happening at these three areas. Okay.
All right. And so when we look at centanafadine in youth with emotional dysregulation and ADHD, what we see is that centanafadine produces significant improvement relative to placebo across defiance and aggression, across executive functioning, and across hyperactivity and impulsivity. The other thing that I want to emphasize here, because as those who have heard me speak before know that I'm interested in the endpoint, but I'm less interested in the endpoint relative to how we got to the endpoint.
Okay. Yeah.
And so I think one of the things that's really helpful in looking at this is that, number one, we see early improvement.
Yes.
So that's something that happens relatively quickly. The other thing that is helpful here is that we see continued improvement over time.
Yes.
So that improvement that we might see at week 2 is not necessarily the same improvement that we see at week 4 or week 6.
Yes.
And I think that's something really important. We talked earlier about the aspect of uncertainty for parents and for kids.
Yep.
If we can give our patients some sense of how the movie might end or what we're likely to see down the road as treatment continues, that can be immensely helpful.
What I love about that analysis is it gives me a little bit of a window into what kind of patient. So notice that post hoc analysis was patients with high emotional dysregulation. The drug worked especially well. And so for those people that maybe a stimulant might not be the best choice, this is a medicine that might treat the core ADHD, but also comorbid emotional dysregulation, depression, anxiety. If you think about a triple reuptake inhibitor, doesn't it make sense that'll work for depression and anxiety?
Absolutely.
As a reuptake inhibitor guy, you know that.
Absolutely.